Tori Turbovich. I'm one of the Alt Care dietitians. Today, I'm going to talk about liver health with you guys. So, prior to getting into our presentation for today, I want you to ask yourself, what do you currently know about the liver? Do you know the roles that the liver plays within our body? Do you know how to support a healthy liver? Do you know the diseases, different types of liver disease? If you are able to answer any of these questions, that's great. If not, at the end of today's presentation, you should be able to take this information away with you and be able to apply it into your daily life. That way, you're able to help support your liver moving forward. So to start off, I want to just go over the liver basics. So our liver is our largest organ in the body. It is located in our upright quadrant, and what that means is it's tucked right up under our liver or rib cage. Um, so it's protected from our ribs. The main role of the liver is to help filter and naturally detoxify our body from substances such as chemicals, medications, alcohol, caffeine. And so all of these are ran through our liver at some point or another to be broken down into something that our body is able to utilize or to be removed from the body. The liver is referred to as the chemical factory, and what this means is that it performs over 500 chemical functions within the body. These range over, there's a large variety of their jobs, but some of the ones I want to highlight are below. The liver is really good at taking one substance in the body and converting it into something that the body needs and will utilize. When we get injured, our liver will help produce blood clotting factors to start the healing process. That way, if we cut ourselves, we're able to start the healing process. Our liver does store vitamins and minerals as well as hormones and cholesterol. And when the body notifies the liver that it needs it, it will be released into the blood and directed to where it needs to go. The liver also helps produce bile, which is then stored in our gallbladder. Once it's stored in our gallbladder and we consume fat, the gallbladder will release the bile to help digest the fats that we consume in the diet. Bile also helps remove toxins or carry the toxins out of our body. That way they don't build up. When we think about liver disease, there are 5 different stages. The first one is a fatty liver, followed by hepatitis, fibrosis, cirrhosis, and liver failure. So, fatty liver is when there is excess fat built up in the liver, typically from our diet, but there are other lifestyle factors that can cause this buildup. Hepatitis is essentially inflammation of the liver. So this means that the liver becomes swollen and inflamed due to an injury, either alcohol, a virus, or obesity. Fibrosis is when there's persistent inflammation causing scar tissue to form, and this scar tissue replaces healthy cells and reduces the function of the liver. Cirrhosis is when there's permanent scarring, which starts to hinder the function of the liver. And then liver failure is when the liver no longer functions effectively because there's so much scar tissue built up, which leads to toxins building up in the liver because it's not able to remove them. The thing is, with these different stages, fatty liver, hepatitis, and the beginning stages of fibrosis, they are reversible with lifestyle changes. And at the end of today's presentation, we'll kind of go through those and I'll provide you with what those lifestyle recommendations look like. There are a large variety of causes that can damage the liver, and they can be viruses like we talked about with the hepatitis, heavy alcohol intake, being overweight, being on certain medications. So making sure that you're talking with your doctor and you're making sure that if you're experiencing elevated and or liver enzymes, you're talking with your doctor and seeing, okay, could one of your medications be causing these higher numbers? If so, is there something you can replace it with? Exposure to industrial chemicals and environmental chemicals. So these are going to be more like pesticides on our foods, or ingredients in our home supplies. And then genetic disorders. There are two different types of genetic disorders that can cause um, damage to our liver. These are going to be hemochromatosis, which is an iron overload, and then Wilson's disease, which is the accumulation of copper in the body. And these will actually cause toxic substances to build up in the liver to where it cannot no longer function. These are the four main risk factors of developing liver disease: high blood pressure, increased waist circumference, high LDL, which is our bad cholesterol, and low HDL, our good cholesterol, and then high blood pressure. So we do want to see these below certain values. High blood pressure, we want to see less than 100. Anything over can increase your risk of liver disease. Waist circumference for men, we want to see less than 40 inches and less than 35 inches for women. For cholesterol, LDL, we want to see less than 130. And then because HDLs are good cholesterol, we want to see that above 50, the higher the better. And then another one that's not on the screen is triglycerides. That is also going to play a role in our risk of liver disease. And for triglycerides, we want to see it less than 150. And then blood pressure, we want to see less than 120/80. So as long as you're following up with your doctor for your annual blood work, you're getting these levels checked, you're able to make sure that they're staying within normal range and just keeping an eye on them throughout your year. When it comes to symptoms of liver disease, I want to note that not a lot of individuals experience any symptoms. When they do, sometimes it's too late. It's in those later stages like cirrhosis or liver failure. But by chance that you do experience symptoms, it could be tiredness. You could experience fever, nausea, vomiting. Your urine could be dark, or you could have pain where your liver is, which is in that upright quadrant of your stomach. One of the most common symptoms of liver failure is going to be jaundice, and this is when you have that yellow tint to your skin or your eyes, and usually at that point it is too late. You're in the later stages. But if you're experiencing any of these, definitely follow up with your doctor. That way you're able to get your liver checked out and make sure you can potentially rule it out. To help diagnose liver disease, it is important that you're going to your doctor for your annual visit. They'll typically run a liver panel, which consists of your liver enzymes, AST and ALT. These are, if they're elevated, they usually indicate the liver is damaged, or there is something else going on in your body. Typically, low levels, normal levels, mean that your liver is healthy, but it doesn't necessarily mean nothing's or anything is wrong with your liver. So if there's speculation something's wrong with your liver from this blood work, they will probably encourage further testing like an ultrasound, an MRI, or a CAT scan. And then bilirubin and albumin, these are two other values that in your blood work that could show something's wrong with your liver. They are antioxidants, which have to be filtered through the liver. So if they're elevated or low, your liver might not be processing them correctly. So now that I've given you kind of a background about what the liver's role is in the body and the different liver diseases and symptoms that you might experience or how to diagnose it, I really want to jump into nutrition management for liver disease. Even if you don't have any, like you don't have any symptoms, you don't have elevated liver enzymes, it still doesn't hurt to put these nutrition recommendations into action and put or practice them on your daily routine because they not only will help support a healthy liver, they can also help reduce different areas of your life or chronic diseases, and just help maintain a healthy lifestyle overall. So, starting, I really want to highlight the importance of fruits and vegetables. So, with a diet or nutrition and liver, it is really important that we focus on whole foods. The reason for this is all of the or fruits and vegetables, whole grains, lean proteins, healthy fats, they not only help support a healthy liver, but they are going to help manage those risk factor numbers for liver disease. So the blood sugar, waist circumference, cholesterol, as well as blood pressure. So that's kind of how these nutrition recommendations play a role in preventing liver disease or supporting a healthy liver. So, with fruits and vegetables, they do provide your body with vitamins and minerals as well as fiber. The new recommendation based on the dietary guidelines for Americans is 2 servings of fruit, 3 servings of vegetables a day, um, and really highlighting a variety of colors. So, berries, peppers, cucumbers, um, tomatoes, just a combination of colors. The more colors you can get, the more nutrients and phytochemicals you're able to add into your diet, which all play different roles. The benefits of fruits and vegetables, they do help reduce inflammation. They're antioxidants, which can help fight against inflammation in the body, which will help your liver, and then they do help manage weight. They can help because of the fiber content. They're able to help manage that bad cholesterol by binding to it and carrying it out of the blood. And then they do help slow the digestion of carbohydrates or the carbs in the fruit and vegetables, which means that they don't cause a spike in our glucose levels. So you're able to manage normal glucose levels better. When it comes to grains, the recommendation is 2 to 4 servings a day. And we really want to highlight whole grains and ancient grains. The reason for this is that they're going to be higher in fiber content as well as vitamins and minerals. They haven't been stripped of these nutrients. So, again, they do aid in slower digestion because of the fiber content, so that glucose isn't going to spike as easily. The fiber from these do feed our healthy bacteria in our gut, and so we're able to improve our gut health. And they just provide our body with energy for the day. So carbohydrates, which come from grains, fruits, and vegetables, they do provide energy to our day. So it is important we're including them, but they reduce the glucose spikes. And then proteins, we really want to focus on lean proteins, and these are going to be meats, poultry, eggs, as well as wild caught fish. The biggest recommendations I have for these is that you're shopping local when you can. Finding a local butcher shop or a local farmer's market in the summer, making sure that the meat you're buying is free of antibiotics and hormones, free of pesticides. You're trying to buy grass-fed options or free range. This just verifies that the quality of your meat. So what you're putting into your body, it doesn't have the potential of adding chemicals or toxins into it, which, like we talked about, can decrease the function of the liver. When you buy fish, it is important that you're buying wild caught versus farm raised. Wild caught does have more or higher amounts of omega-3s, which are those healthy fats, less of the saturated fats. But farm raised, there is a risk of pollutants and contaminants being in them, which if you consume them, you can then put into your body. So wild caught, there's less of a risk of that. And then, of course, making sure that you're incorporating healthy fats. These help reduce inflammation within the body. And so just making sure you're getting salmon, tuna, you're cooking with avocado or olive oil, you're eating avocados, nuts and seeds, to get these into your diet. So I talked about how whole foods are very beneficial for in supporting liver health. We really want to reduce processed foods, especially added sugars and starchy carbohydrates or processed carbohydrates. The reason for that is when we consume them, they're digested into glucose and fructose. Glucose, we know, immediately goes to our pancreas, which releases the or increases the release of insulin. Our fructose will go to our liver because that is the main processing unit. However, when we overload our liver with fructose, it's not really able to process it or remove it. And so it starts converting that fructose into fat, which is then stored in liver cells. That fat being stored into liver cells is what builds the fat deposits on the liver, leading to fatty liver. Like I mentioned at the beginning, when you get the fatty liver, it does cause more inflammation. It does prevent the body from or it increases the risk of insulin resistance, which can damage liver cells. I mentioned at the beginning that fatty liver is reversible. So if you ever get this diagnosis, try to take the initiative and incorporate the nutrition and then the lifestyle recommendations I'm about to incorporate or talk about, try to incorporate them. That way you're able to reverse that diagnosis. So, for instance, if you drink a lot of alcohol or you drink a lot of pop, try to start with cutting those out as a first step. And then other foods that can be beneficial for our liver health are coffee, berries, kiwi, edamame, dark chocolate, legumes, garlic and green tea, extra virgin olive oil, cruciferous vegetables like cauliflower, broccoli, Brussels sprouts, and cabbage, as well as lean proteins and nuts and seeds. All of these foods on this slide are made up of polyphenols and antioxidants, which help reduce inflammation within the body, which can help protect our liver a little more. If you feel like you are doing everything nutrition-wise, you're incorporating lifestyle recommendations that we're about to talk about, but you're still struggling to support a healthy liver, there these are the top 3 supplements that can also help support your liver. Vitamin D, research has shown low levels are associated with higher risk of a fatty liver. Um, so making sure you're talking to your doctor and you're getting your levels checked. It doesn't mean low vitamin D causes a fatty liver, but there is an association. So if you have low vitamin D levels, try to get on a supplement, especially living here in Ohio. We do not get sunlight through the winter months. So a lot of Ohioans are deficient during the winter. So making sure you're taking a vitamin D supplement consistently, and then you're getting outside during the nicer days when we have sunlight. Another one is going to be omega-3s, which are fish oil supplements that have a combination of DHA and EPA. These help reduce those triglycerides, which is a risk factor of the fatty liver. Omega-3s are also good at reducing inflammation in the body. And then the last one are probiotics. These introduce and add healthy gut bacteria to our microbiome to help it flourish and adds diversity. And you might have learned in the past, or if you don't know already, that our gut is kind of our center of our health. So if we take care of our gut, we incorporate these healthy bacteria, we feed them with fiber, it can help reduce our risk of chronic diseases. So making sure you're getting those in if you aren't a fan of fermented foods. So now moving into the lifestyle recommendations. So we talked about the nutrition. Now we're moving on to exercise, stress, sleep, as well as those toxins I keep talking about. So first, I want to talk about movement. So traditional exercise is beneficial in its own ways. It does aid in digestion. It helps utilize glucose in the body. That way, it is not just sitting in our bloodstream, it's being pushed to our tissues to be used. It does help strengthen our muscles, bones, and joints, releases endorphins, and boosts our mood. So it's a great stress reliever if you don't already do it. It can help promote adequate sleep. And if you're working on improving blood work, exercise is associated with a decrease in blood values. So we do encourage traditional exercise, which could be cardiovascular training or strength training, 150 minutes of moderate every week. And that could be running, walking, biking, or even pickleball. And then strength training. So strength training can be body weight exercises, resistant bands, or more your dumbbells, kettlebell kind of workouts. However, it doesn't necessarily, to help support a healthy liver, it doesn't have to only be traditional exercise. Any type of movement throughout the day is better than none. So if you're at home and you have house chores, if you have yard work, or if you move around at work, those are all beneficial and going to help support a healthy liver. We also want to make sure that we're getting adequate sleep every night. And I know everyone's body is different, but really trying to aim for the 7 to 9 hours a night can help support your overall health. Our sleep does impact our hormones, which can directly influence our metabolism, our appetite, as well as fat storage. So, by getting adequate sleep, you are able to increase your metabolism, um, and then decrease the fat storage. You're able to utilize more nutrient or more of the fat. So, getting too little sleep, it is associated with insulin resistance. So, your body's not going to utilize glucose as easily, and it can alter those hunger and fullness cues. So, if you've ever noticed you're tired, but you snack more, um, you ignore the fullness cues and you kind of have more cravings for the starchier foods. When it comes to stress, the biggest thing is that we're managing our stress levels. So chronic long-term stress, it can be inflammatory, which we've talked about is negatively going to hurt our liver. That inflammation can damage our liver cells. And then so really prioritize reducing your stress levels if that's through some grounding techniques such as deep breathing or meditation or kind of the 5 4 3 2 1 technique where you use your senses, kind of regrouping yourself. That way you're able to refocus on the task at hand. Also, at work is when we get very stressed sometimes. And so making sure that you're utilizing the word no or delegating tasks. That way you're not having everything put on yourself and adding to that stressor. And then the last thing I just want to reiterate is that liver disease is reversible. So those early stages of fatty liver, hepatitis, and fibrosis, they are reversible with dietary and lifestyle changes. So if you ever get a diagnosis of one of these, I highly recommend or putting these recommendations into action. That way you're able to reverse that diagnosis because the liver is able to regenerate itself. So even though there's inflammation, there's fat deposits, and it's causing damaged liver or damaged cells, your liver is able to create new cells if you incorporate these new lifestyle changes. However, once you get to the later stages of liver disease, it does not, or becomes harder or it becomes non-reversible because too much scar tissue has built up. So our liver will become overwhelmed and isn't able to build those new healthy cells anymore. The next few slides, these are just kind of taking a little bit of what I've talked about and then adding a few more recommendations on how to support your liver through your nutrition, your exercise, your stress, as well as toxins. So you can print these or write these slides down, hang them up somewhere, and just cross them off as you feel you're able to incorporate them. So here we have movement, setting goals, incorporating different types of movements, if that's walking, house chores, yard work, or your traditional exercise, any way to get more movement in throughout your day. Making sure that you're checking in with yourself and you're able to manage your stress levels. And then the last one is reducing those toxins. So I mentioned fruits and vegetables earlier on. There are the Dirty Dozen and Clean 15, which are the top 12 produce items that have the most pesticide use versus the 15 with the least pesticide use. That, if you can, buy the Dirty Dozen ones or as organic products. But if organic is not in your budget, that is perfectly fine. It also is a reminder that anytime you eat produce, make sure you're washing it to help remove some of the pesticides or dirt from your food. Use stainless steel water bottles or reusable water bottles. Glass containers. Look at your pots and pans. What kind do you have? A lot of times we like those non-stick pans, but the non-stick part of it has or can add chemicals into your body. And so trying to find a cast iron or a stainless steel pan that you're able to cook in every day. Also, if you want another resource, the EWG website is a great resource for home products, looking into more ingredients that you should avoid in your laundry detergent and your soaps and lotions or cleaning supplies to help remove some of these toxins going into your body. If you guys have any questions, please don't hesitate to reach out. Otherwise, enjoy the rest of your day.